Hi everybody, this is Judy at Judy in the Kitchen. Today we're talking about ginger and the nutritional aspects and health benefits of this very popular food that's out there. We know that ginger is very high in vitamin C, vitamin B6, magnesium, potassium, copper, manganese, fiber, and even water, and it has an array of very important phytonutrients, and those are the things that give ginger its special medicinal properties. Now, before we get into those medicinal properties, I want to go over some precautions about ginger, and these are very important for some people, but not necessarily for everyone. Ginger root is generally considered to be safe with up to 4 grams a day, usually being without issue. With higher doses, such as eating a whole knob at one time, there is the possibility for getting some gastrointestinal discomfort, maybe allergic reactions, prolonged bleeding, central nervous system depression, and even heart arrhythmia. Higher doses may interfere with the action of the drug warfarin, which may lead to bleeding. Excessive intake of ginger can lower blood pressure too much, leading to heart arrhythmia in a few people. It may also aggravate gallstone formation by increasing bile acid secretion. So it's wise to consume ginger appropriately and avoid excessive intake. To be safe, check with your doctor if you're on specific medications before taking large amounts of ginger. Small amounts for flavoring probably is okay, but if you're in doubt, check with your doctor first. Now, regarding those special health benefits by ginger, it has antioxidant protection for sure. Antioxidants are important in the body for fighting free radical molecules and reducing oxidative stress. Free radicals are naturally produced in the body, so antioxidant protection is vitally important in neutralizing those harmful molecules. Many plants, including ginger, are rich in natural sources of antioxidants. Regular consumption of these compounds really reduces lipid oxidation and our risk of disease while providing anti-carcinogenic and anti-mutagenic activities. Because of its antioxidant activity, including ginger in the diet can help to boost the immune system and reduce our risk for disease overall. Regarding digestive health and nausea relief, ginger has been used for centuries as a remedy for nausea and indigestion. It's a folk remedy that really does work. The phytochemicals in ginger appear to accumulate in the GI tract, giving anti-inflammatory effects, and this helps to relieve GI pain and nausea. Studies have found that consuming between 1 and 2 grams, which is 1/2 to 1 teaspoon of ginger, could help to reduce nausea and vomiting, morning sickness, motion sickness, upset stomachs, and side effects from chemotherapy. Since ginger is so potent, large amounts should not be taken unless you're under a doctor's care. I can't emphasize that enough. Ginger may help manage chronic indigestion by speeding up the passage of food through the stomach. Functional dyspepsia, upset stomach, is when a person has indigestion like abdominal pain, bloating, feeling too full, belching, and nausea for no clear reason. In a study reported in the April 2015 issue of the journal Evidence-Based Complementary and Alternative Medicine, researchers found that consuming a ginger and artichoke preparation for 4 weeks before eating lunch and supper significantly improved the symptoms of indigestion in those with functional dyspepsia when compared with taking a placebo. Also, ginger has been found to reduce fermentation of food by bacteria in the intestinal tract. This can help to relieve discomfort of gas, bloating, and constipation. Ginger also has anti-cancer benefits. It's been found to be effective against various types of cancers, especially those of the GI tract, including pancreatic cancer, liver cancer, colorectal cancer, breast cancer, and cholangiocarcinoma. That's a type of cancer affecting the bile ducts of the liver. Ginger's also been found to enhance the effect of drugs used to treat cancer, in addition to treating the nausea and vomiting associated with chemotherapy. So regarding cancer, it appears that you can't go wrong with adding some ginger to your diet, both as a preventative and during traditional treatment. Ginger can also help to reduce cholesterol and the risk of heart disease. It is well established that high levels of cholesterol are linked to an increased risk of heart disease and stroke. Some studies suggest that adding ginger to your diet can help to reduce your LDL cholesterol, your total cholesterol, and triglycerides. In a study reported in the September 2008 issue of the Saudi Medical Journal, researchers gave subjects 1 gram capsules of ginger 3 times a day for 45 days, and that's going to be roughly about a teaspoon or so of ginger 3 times a day. The treatment group members experienced a significant reduction in triglyceride, cholesterol, and LDL levels when they were compared with the control groups. This is significant. The researchers concluded that ginger has a significant lipid-lowering effect compared to a placebo. Similar results were discussed in a meta-analysis of 12 clinical trials reported in the April 2018 issue of the journal Phytomedicine, and also in a clinical trial report in the February 2018 issue of Clinical and Medical Biochemistry. So it appears to be very well established that the addition of ginger to your diet can help to keep your blood cholesterol levels in check. Bear that in mind if you have a cholesterol issue. Ginger can also help to reduce your blood sugar levels. In a study reported in the May 2022 issue of the journal Complementary Therapies in Medicine, researchers examined 10 trials of participants given from 1,200 to 3,000 milligrams of ginger a day for 8 to 13 weeks. They found a significant reduction in fasting blood sugar and hemoglobin A1C in people with type 2 diabetes. They also noted reductions in several other blood markers indicative of oxidative stress, which we know is a risk factor for heart disease. So if you or someone you know has diabetes, especially type 2 diabetes, suggest that that person includes some ginger in their diet as often as they possibly can, and it may very well help their situation. Ginger can also help in reducing menstrual pain. In the December 2018 issue of the Taiwanese Journal of Obstetrics and Gynecology, researchers conducted a crossover clinical trial involving 168 women ranging from 18 to 26 years of age. They were divided into 2 groups, with one group taking a drug for menstrual pain while the other group took ginger. The women took their assigned treatment for 2 cycles and then they switched to the other treatment. Pain levels were measured before, during, and after treatment, and they found that ginger was just as effective at treating menstrual pain as the drug that they were given. They concluded that treatment with natural ginger was the preferred method over using a synthetic drug. Bear that in mind if you suffer from menstrual pain every month. Try adding some ginger to your diet, and it may very well help you. Ginger also has potential antimicrobial benefits. The strong compounds in ginger have antimicrobial properties that could make it useful for fighting bacterial and fungal infections. Laboratory studies have found that ginger may be effective against Staphylococcus aureus, E. coli, and Candida albicans, and others as well. Those microbes are well known for causing a range of health issues. The compounds in ginger have also been found to be effective against periodontal bacteria, With microbes becoming increasingly resistant to drugs, coupled with possible drug-related side effects, natural means of fighting these pathogens is important. Ginger can also provide relief against osteoarthritis pain. As reported in a 2014 issue of the International Journal of Physiology, Pathophysiology, and Pharmacology, ginger's been shown to provide a potentially significant role in the treatment of osteoarthritis. Studies have revealed that ginger can be used to treat pain associated with arthritis without the potential harmful side effects of common pain medications. Ginger also has neuroprotective effects. Ginger has been shown to have neuroprotective benefits believed to stem from the antioxidant properties of its phenolic and flavonoid compounds. Since oxidative stress and chronic inflammation appear to be key drivers of cognitive decline, ginger may help protect us from degenerative diseases like Alzheimer's disease, Parkinson's disease, and multiple sclerosis. I do hope this helps you out. We can't say enough for the health benefits of ginger. So if you're not already including that in your diet, I want to suggest that you include it any way that you can. Take care. I hope this helps. Bye for now.